Okay, so I am doing the central line change, the blood draw, and the medicine. I would do all the things as in like walk in, provide privacy and hygiene. I would check the patient, 2 identifiers, name and date of birth. I would look at the computer, check the orders, the blood draw orders and stuff like that, check and see if he has any allergies. I would then explain to him what we are going to do. I have a table set up over here for everything. So after that, I would have 2 masks. I would put one on the patient. Sorry, stuck in my glove. I'll put one on the patient. Okay, it's on the patient. And then put one on myself. Get rid of gloves, hand hygiene. Okay. Then I would, once I have new gloves on, I would take off this central line dressing. I'm gonna change the dressing first, making sure I secure the line, not letting it fall out. Okay. Take this, making sure it's still secure. Once I have that off, I would change my gloves, hand hygiene. I would put on a sterile pair of gloves, stay sterile this whole time. I would then grab a chlorhexidine swab and I would swab up and down motion for 30 seconds. Once I do that, I would, that just got stuck to my glove because I had old tape residual on it. I would then let this air dry, take my new dressing, making sure that we cover this well. New tape. Usually I would use a clear, transparent, antimicrobial dressing. Okay, that's secure. With the pick, we would make sure it hasn't moved at all. So we would actually measure the lumens or the lines itself to make sure it hasn't come out any or gone in anymore. So that is part of the changing the dressing. Take this off so I can breathe. Then for blood draw, we would do the same thing. Just want to make sure, starting over. Walk in, provide privacy, hand hygiene, 2 patient identifiers. I would walk through and tell them about the procedure. Then I would go over, check my orders for the blood draw, like I said before. Have everything ready nearby. So I would hand hygiene again, put on gloves, and we would get some gloves. So usually if this is hooked up to medications, we would clamp the line, undo the medications. Once we have that undone, we would take an alcohol swab, clean it really well. Okay, we would take a flush. Use this entire flush to flush the medications with the normal saline. Okay, once we have that, we would then take another flush, but first clean the hub. We would take an empty, we wouldn't take another flush, we would take an empty, oh my gosh, syringe, sorry. And we would gather our waste, which will be a whole syringe full. We would set this aside, put it in the biohazard, and then once we have taken our waste, I will attach this, which helps us get our tubing and get blood. I would first clean that with alcohol, sorry, and then attach that, and then I would get my blood. Got that one. Then I would get this. Got that one. Then I would remove this, clamp the line, alcohol swab, all with new alcohol swabs, of course. I would then unclamp the line, flush it, clamp the line, and put a gross cap on it to make sure it's covered, or connect the line, or alcohol swab it, connect the line back, and then restart the infusion. And then with medication, I would come in and do all of the privacy, hand hygiene, check my orders, 2 patient identifiers, check the allergies, tell them what kind of medication is, what it's for, and then I would put on gloves. I would, if there was a cap on it, I would take the cap off. Okay, well first I will draw up my medication. So I'll have my medication, get a blunt tip and a syringe, and I will draw up my medicine. Okay, once I have that, I will put this back in the empty blunt tip container, set it right there so I can carefully clean this hub. Would then take the cap off, get a new alcohol swab, of course, clean. I would first flush the line, make sure it's patent, no pain. Okay, take that off, then take my medication, take my blunt tip off. I'm not letting this cap touch anything. Already swabbed the hub. I would then take my medication and I would slowly push it, depending on which medication. Clamp it, undo it, take a new alcohol swab, scrub the hub, get a new saline syringe, flush, attach it, unclamp, slowly flush, clamp, take this off, put on a cap, ask if there's anything else that he needs, and that is it for the medication. I will say for the blood, I forgot to say, because I couldn't find a blood bag, once I would collect the blood, I would put the patient label on it. I would personally recheck the orders just to make sure I got everything, put it in a blood bag. Well, I would scan it, then put it in a blood bag, and then send it to lab. But yeah, I would take my gloves off after the medication, of course, hand hygiene, bed locked, lowered, call light, locked, lowered, and the rails, and that is it.